We are going to talk about keeping children safe while rear-facing in motor vehicles. Child passenger safety is so important. It's vital because crashes are a leading cause of death for children aged 1 to 13 in the U.S. In 2022, 756 children died in vehicle crashes. 46% of those were unrestrained. We do not know if the other 54% were wearing their restraints correctly. What we do know is that when drivers don't wear restraints, 60% of children also go unrestrained. These statistics show that many child passenger injuries and fatalities are completely preventable. Important safety need is you. Driving a car is likely the most dangerous thing you do in your everyday life. Speeding, distracted driving, impaired driving, vehicle sizes are all increasing in our communities, even if you drive safely. So encourage safe driving behaviors by displaying them yourself. Stay off your phone, don't let yourself get distracted, and buckle up every trip, every time. Labels that are standard throughout the industry. Always read and understand car seat labels before use. These labels include height and weight limits, manufacture date, lower anchor and seatbelt routings, compliance with USA regulations. Some will even include the expiration date. Please pause this video to check your car seats labels. Compliant car seats. Not all car seats are legal for use in the U.S. Some are unsafe or counterfeit imitations intended to mislead customers. They often appear as a well-known brand, but are made with subpar materials that break during collisions, and they have no crash testing. View your labels for the manufacture date, model number, model name, height and weight limits, warning labels, and other regulatory compliance indicators. Verify that your car seat has all essential parts, such as a chest clip and a 5-point harness, noting the strap width should be 1.5 inches. Verify that your car seat or base has an attached lower anchor and a seatbelt routing. Examine the manual for detailed English instructions, including lower anchors and seatbelt installation methods. Make sure your car seat included a registration card for any potential recalls. Stands for lower anchors and tethers for children. Shown below are common lower anchors and the lower anchor attachment in your vehicle. Also shown is the top tether on a car seat and the top tether attachments in the car. Are in a product that is sold separately from your car seat. These include cushions, shoulder pads, headrests, pillows, and other comfort devices. Weather protection can fall over the child's face or prevent adequate airflow. Any aftermarket product can change the fit, placement, and tightness of the harness, which can lead to injury or death. Toys and mirrors are potential choking and strangulation hazards, and they can also become a projectile in a collision. Be aware that there are no federal safety standards, thus crash tested and 2 FMVSS standards are misleading. We see is chest clip placement. Where do you think the chest clip should go? In the yellow stripe, the red, or the blue? Be at the armpit level or the red stripe. This ensures the straps will stay on your child's shoulder for the duration of the car ride and in the event of a crash. If the chest clip is too low, the harness can slide around the body and the child can come out of the car seat. If the chest clip is too high, it can cause breathing issues or be uncomfortable, which would lead to older children lowering it too far down. How do you know if the harness is tight enough? You should not be able to pinch slack at the shoulders. The harness should be flat and straight between the chest clip and the crotch buckle. And it should be snug over the hips with no slack. Loose harnesses do not keep children in the correct position and can lead to suffocation. Loose harnesses can also cause injuries, and children can come out of the seat in a crash. Where do the shoulder straps go? When rear facing, the shoulder straps should wrap behind the shoulder like a backpack. Check the car seat's recline indicator. Car seats have to be at the proper recline to keep a child's airway open and to prevent slouching, which can lead to injuries in a collision. Installation tips. Verify the car seat or base moves less than 1 inch or 2.5 centimeters side to side and front to back at the belt path. That is where the car seat is buckled in. The top of a rear-facing car seat will move more as it is not connected to anything. This is a good thing during a crash. Use the lower anchors or the seat belt, not both. Keep in mind that lower anchors have a weight limit listed on the side of your car seat. Make sure the webbing of the lower anchors or seat belt is not twisted. If using the lower anchors, make sure that they are right side up. If using the seat belt, make sure that your shoulder belt is locked. And make sure the angle is correct per the indicator. The next stage too soon. When children hit milestones, we get excited, especially if they meet them early. Car seat safety is the opposite though. We want our children to stay in each stage for as long as possible to keep them as safe as possible. Using an age and size appropriate car seat or booster seat can reduce serious and fatal injuries by up to 80%. Every step up is a step down in safety. The next stage, regularly check your child's height and weight. When they reach the weight limit, time for a new seat, not before. When they reach the height limit, time for a new seat, not before. It is whichever they reach first. They only need to outgrow one limit, not both. Do not transition before the height or weight limit is reached. The American Academy of Pediatrics, the Center for Disease Control, and the National Highway Transportation Safety Association all recommend staying in each stage until the height or weight limit is reached. By the Swedish National Road and Transport Research Institute, rear-facing car seats can reduce serious injuries by 92%. During 30-mile-an-hour collisions, children who were rear-facing only had a 50 kilogram of force on their neck, whereas children who were forward-facing had 300 kilograms of force on their neck. Children do not have fully developed bones, including their vertebrae. At birth, each vertebrae is 3 separate bones held together by cartilage. That cartilage can stretch up to 2 inches. A quarter-inch stretch can rupture the spinal cord, resulting in paralysis or death. Vertebrae are not fully formed until between 4 and 6 years old. Children not have fully formed bones. Their bodies are in very different proportions than that of adults. A 9-month-old baby's head comprises 25% of their total weight. An adult's head only comprises 6%. A 6-year-old head is roughly 10 to 12% of their body weight. What is the best seat? The best seat is the one that fits your vehicle, fits the child's age, weight, height, and developmental level, and it is one the parent or caregiver can confidently and correctly use every time. Car seats are comprised of rear face only, convertible, all-in-one, and all-in-one or 3-in-1 car seats. Feet to touch the seat? Yes. It is perfectly safe for feet to touch the back of the seat. When rear-facing, we do not see leg injuries even when the legs are long. Children can cross their legs or put them on the back of the seat. We do not want to transition to forward-facing too early due to spinal development. We see more head, neck, spine, and leg injuries while forward-facing. Child unbuckles during travel. Identify the root cause, their age, their developmental stage, sensory issues, special needs, or discomfort with the car seat itself. Utilize positive reinforcement. Encourage and reward your child for staying buckled during trips, promoting safe behavior. For children in 5-point harnesses, you can button a shirt up backwards over their harness. For children in booster seats, consider going back to a 5-point harness. Some car seats are also easier to unbuckle than others. If your child has special needs or sensory issues, you should talk to your occupational therapist. By understanding your child's needs and implementing these strategies, you can help ensure a safer travel experience for your whole family. Children are always safest when seated in the back seat of any motor vehicle. To sit in the front seat, children should be at least 13 years old, unless the back seats are all taken by other children. Rear-facing car seats should never be placed in front of an active airbag. And make sure to check your local laws. Laws are the bare minimum you do to not get a ticket. They are not always the safest way to travel in a car. Are used car seats safe? Yes, if you know the history of the seat. It's not been in a crash or recall. It's not expired. It's not missing any labels. And it has been cleaned to the manufacturer's guidelines. Minor crash, check the manufacturer's recommendations. After a moderate or severe crash, you need to replace your car seat. NHTSA has a guideline on which crashes are minor and which are not. Dispose of any car seat, you can recycle it, take it in during participating stores' trade-in events, or you can throw it in the garbage. If you throw it in the garbage, you must cut all webbing and fabric, label the seat "Do Not Use" and "No Use Are." If possible, place the parts in different trash containers. These steps will help prevent endangering a child's life by reducing unintended use. Trains and buses are safer than personal vehicles. Fatality rates for car occupants are 23 times higher than for bus and train occupants. Infants are safest when properly secured in a carrier or baby-wearing device. If using the carrier, place it on the ground to prevent falls. Toddlers and older children are safest in their own seat, not on your lap. From the start of Denver's Vision Zero in 2017 up until this recording, there have been 0 fatalities of bus or train occupants, compared to the over 300 personal vehicle occupant deaths in the same time frame. Dress your infant in a single layer only. Once they are buckled in correctly, tuck the blanket around them to prevent them from pulling it over their face and to ensure their safety and comfort. Are snowsuits safe? No. A German experiment simulated 10-mile-an-hour crashes. The padding from winter clothing caused the seatbelt to cut deep into the abdomen, resulting in severe injuries. This applies to adults and children. No coats, no snowsuits, and no bulky layers. Those bulky layers can also compress during a collision, and your child can come out of the car seat. We're going to do our demonstrations. For some additional resources, pause at the next slide. Hope that you have taken the time to learn this life-saving information and hope that you share it with friends and family. Remember to wear your seatbelt, avoid distractions, and encourage safe driving practices. Thank you.